test that you need to get done, which is B12. Lack of vitamin B12 can cause burning sensation. So if you ask your GP to do that, that would be good. আমরা পরবর্তী কলে যাচ্ছি। হ্যালো কলার, আসসালামু আলাইকুম, আপনি কে বলছেন এবং কোথা থেকে বলছেন? হ্যালো, আসসালামু আলাইকুম।
Hi, I'd like to not say my name, but
that's fine.
I've got 2 questions.
Okay, go ahead.
First of all, my mum had a heart attack a couple of months ago.
Okay.
And now she's got a battery installed. So I'd like to know what is the difference between a person with normal heart and a person with a battery rate heart, and also what exercise.
When you say battery, you mean pacemaker?
Yeah, pacemaker. Yeah.
Okay, so she had arrhythmia.
What exercise can she do?
What exercise can she do? Okay, so Dr. Odetonbo, this young lady's mother had a MI, as she said, a heart attack, and she's obviously got an arrhythmia and has a pacemaker. She'd like to know what form of exercise should she do.
The function of the pacemaker is to make sure that the heart beats normally at the usual rate. Therefore, there's no limitation to the sort of exercise that they can do. They can do any exercise to keep them fit. Obviously, within limits. If they don't have a chest pain or anything like that, they can do any exercise that they can tolerate.
Okay. আমরা পরবর্তী কলে যাচ্ছি। হ্যালো, আসসালামু আলাইকুম কলার, আপনি কে বলছেন এবং কোথা থেকে বলছেন?
হ্যালো, আসসালামু আলাইকুম।
হ্যালো, আসসালামু আলাইকুম। জি, আপনার প্রশ্ন কি আপা?
হ্যালো, যে আমার দুটো প্রশ্ন আছে।
হ্যাঁ, বলেন।
একটা ব্লাড প্রেশার রিলেটেড, এটা হচ্ছে যে অ্যাজমা রিলেটেড।
Okay.
Idaning, I received some sort of email which says there is a device called Respirate, which reduces blood pressure. You don't gradually you don't have to take any medication. Is that true? The device is really expensive, like £200. And also having garlic, raw garlic in the morning, does it reduce pressure? And I have another question about my asthma. I'm suffering asthma for the last couple of years. What happens these days, I'm getting it more and more. It's really to get the appointment with the GP, and whenever you get appointment, they only put you on, if I'm taking 1 puff in the morning, the preventer, they will give 2 puffs, morning, after and evening. It doesn't prevent actually. It's really frustrating that we are not getting proper treatment. And what sort of, is there any permanent treatment for asthma? Can we take any herbal sort of things or anything which can prevent asthma properly, I mean cure it properly?
Okay, that's 3 questions. Okay, okay, thank you, Appa. Okay, briefly checking if you want to take the 3 questions. One was about I think the high blood pressure medication being given by an expensive device. I'm not sure which that is.
Expensive device.
Yeah, I'm not quite sure. And the second part was about asthma. So if you want to take those 2 questions.
Okay. About the asthma, it is very essential to control asthma. And as we had said earlier, there are 2 main types of inhalers. The blue one that works immediately, keeps the airways open, and the preventer which keeps it open longer. In most cases, when
I think she also wanted to know if there are any herbal remedies that she could use, but I think our advice would be herbal remedies don't work.
Mainly, you should use the medications prescribed by your GP.
I think if you're losing control, one of the things we'd advise, isn't it, is that if she's not getting control with her preventer on 1 puff, then also that can be increased. But also you could have, there are long-acting beta agonists such as salmeterol and other, I don't want to actually give names, but there are other inhalers that work over a longer period of time, 12 to 24 hours. And often we put patients who lose control on that. So it's well worth just going back to your GP and saying, look, I'm sorry, but you're not listening to me. You need to listen because I'm losing control. The other avenue you should explore is your nurse practitioner or your nurse. They're usually very good at managing asthma. Yep. And we often do ask them to because they manage a lot of the asthma, to see the nurse. So do go and see your nurse about that. আমি পরবর্তী কলে যাচ্ছি। হ্যালো কলার, আসসালামু আলাইকুম, আপনি কে বলছেন এবং কোথা থেকে বলছেন?
হ্যালো, আসসালামু আলাইকুম।
আসসালামু আলাইকুম।
আমার দুটো প্রশ্ন আছে
জি খুব আপনার প্রশ্ন কিতা
পয়লা প্রশ্ন হলো গিয়া লিভার ফেট না মানে একটা জিনিসটা কিতা আর একটা থেকে ইয়ে করতে গেলে মানে কিউর ফাইতে করা লাগবে
লিভার টেস্ট তাই নি
যে লিভার ফাট
আচ্ছা তো এটা হলো গিয়া পয়লা প্রশ্ন আর সেকেন্ড প্রশ্ন কিতা
সেকেন্ড কোয়েশ্চন হলো গিয়া মানে আমার শাশুড়ি আর কি মোটামুটি 50 ইয়ার্স তাই না কি কিন্তু খাইতে গেলে গোলাপ লাগি যায় এটা কিতা লাগে
ওকে